love-hate relationship with insurance in your practice? As in, your patients love to think every procedure should be totally covered, and you hate telling them that's not exactly how it works. As frustrating as insurance is for administrators and confusing as it is for your patients, you have to remember they value it. And like it or not, it may figure into their treatment decisions. So we have to be proactive and prepared whenever possible to use their insurance as a benefit, increasing the chances patients will accept treatment. Here's an important point to remember. Every time you make a clinical diagnosis, a series of obstacles pop up in the patient's mind. I didn't know I have that problem. This means I have to come back? How long will it take? And of course, what will it cost? As dental professionals, your job is to remove those obstacles, and insurance is a huge one. Even if it's not spoken, that insurance question is certainly on their minds. I wonder if I'm covered. And too often, the practice's answer amounts to, let me go check. And in that moment, that is not what the patient wants to hear. That's not a way to remove the obstacle. Let's say you get a call from an adult explaining he hasn't seen a dentist in several years and is in some discomfort. This strategy begins when you're triaging the patient. During triage, you determine the nature and location of the problem. You've learned about his history, and you're sensing an old crown may need to be replaced. Perhaps fluoride treatment will also be a part of the clinical conversation. Stop here and think about what you typically do next. Would you wait until he comes in to learn if your assumptions were correct? Or would you take a step further and call his provider ahead of the appointment? That's exactly what you're going to do in this strategy. After triaging the patient, be sure to get the insurance provider and ID number. Then, you will call their insurance ahead of their appointment to find eligibility details. That way, if he in fact needs that crown, you can say, Mr. Bell, I went ahead and checked with your insurance, and because that crown is more than 5 years old, it is eligible for replacement, and they will cover 50% of the cost. Also, I learned you're lucky enough to have full coverage for fluoride, which will keep your teeth healthy and only takes about 2 minutes. So let's look at that added potential benefit of this strategy for you. Take a practice of 1,200 patients. If 15% have coverage for fluoride, at $35 per treatment, that's a potential $6,300 of revenue for the practice at no cost to them. And all you have to do is check their insurance ahead of the visit. Now let's consider a patient who's just learned she's a candidate for periodontal therapy. Think of what's immediately going through her mind. You're telling me I have gum disease? I'm going to have to come back here multiple times? This sounds expensive. How much will that cost me out of pocket? Can you sense the obstacles popping up? Again, I can check is not going to remove that obstacle. Additionally, think about the wasted time checking with the insurance that could have been spent potentially converting that patient to same-day scaling and root planing, had you known the front-end coverage the patient had for that diagnosis. By checking with her provider on the front end, you can make the proper notes in the chart and be prepared to present her insurance as a benefit when presenting treatment. And that conversation might sound something like this. Mrs. Green, we're noticing increasing inflammation of your gums and significant bone loss, which makes you a candidate for periodontal therapy. This is important because we know that untreated periodontal disease can impact your overall health. Using a procedure called scaling and root planing, we treat the problem well beneath the gum line, get that inflammation under control, and make your mouth stable again. We have already checked with your insurance, and great news, they cover 80% of this procedure. So here's what you've accomplished. You've explained the treatment, presented why it's important, reassured the patient of the solution and where insurance comes in. You've let her know that you understand cost concerns. And finally, you cared enough to check with her insurance provider in advance to understand her specific coverage. That goes a long way toward building trust and removing these obstacles. So the key takeaways here, advanced communication with insurance providers is crucial to removing financial obstacles for the patient. During that initial call, ask detailed questions to best triage the situation. Is it cold or touch sensitive? Which tooth is it? Are your wisdom teeth out? Can you count from the back with your tongue so that we can tell which tooth it is? Gather as much information as you can. Get their detailed insurance information. Use those details when you call their provider to learn what clinical solutions they may or may not be eligible for. Make detailed notes in the chart so you are ready with specific details about their coverage during treatment presentations, or better yet, your morning meeting. When you're prepared with answers to their insurance questions, it tells them, you can trust us because we are looking out for your health and your concerns about the costs of maintaining it. Just another step in removing those obstacles to treatment acceptance.